What is postpartum depression? So it is basically categorized under mood disorders in which postpartum women are suffering. So as ma'am said here that the prevalence is around 70 to 80%, I would like to correct her here. So the prevalence of postpartum depression is 15% in postpartum women. 70 to 80% of the cases, they are not postpartum depression, it is postpartum blues that we usually call it as, and it is not as severe as postpartum depression or postpartum psychosis. So a woman, can I use this?
Whatever.
Yeah, I think this is more. Okay. So a woman is more vulnerable for any mood disorders during 3 phases of her life. In the premenstrual phase, the postpartum phase, and the perimenopausal phase. We all know the common denominator here is the changes in the hormones that are happening in the body, the sudden surge of hormones and a sudden dip of hormone. Out of these 3 phases, the most sensitive period is a postpartum period, right? So postpartum period, usually these mood disorders are considered to be diagnosed when the symptoms are present from birth till 1 year after birth. Okay, so let us discuss about it. So postpartum depression, the mood disorder, it can affect shortly before or soon after childbirth. It affects irrespective of the age, the gender, race, economics, and education. Did I say that it is irrespective of gender? Yes, it is true. Because postpartum depression can be diagnosed in fathers also. However, the prevalence of postpartum depression in fathers is less as compared to the women who are suffering from it. So in fathers, it is around 8 to 10%, and women who are suffering from postpartum depression, it is around 15%. Uh, so a woman who is suffering from postpartum depression in the first pregnancy, the chances of her having the postpartum depression in the subsequent pregnancies, it increases. It increases by around 50%. Also, if there is a history of depression prior to the pregnancy in a female, then also she is at risk of postpartum depression, and the risk increases to around 25 to 30%. So it is a potentially dangerous condition. Why? Because research have shown that in the US, the postpartum depression is a leading cause of murders in children less than 1 year of age. Uh, that report and such results are not available in India somehow. So yes, it causes death of children, which is by the mothers who are suffering from postpartum depression. I would also like to give you a clinical example. So, a case history. Around 15 days back, 2 weeks prior, I got a call from ICU that a young female, 29-year-old, she was admitted with alleged history of consumption of Harpic at her home when the husband was not there. She was a working RMO in a tertiary care hospital. So she gave birth around 6 months back to a baby boy. For a month, everything was all right. Her mother was staying with her to help the baby and the mother. So now, then the time came when the mother has to leave. Slowly, the patient started feeling an overwhelming anxiety about how will she handle the child, and she started getting sleep disturbances. There was fluctuations in the mood, irritability was present, sudden crying spells was seen. In the night, she used to get up repeatedly to check the baby whether she is fine, baby is fine or not. She started feeling that she cannot take care of the baby alone, and she is not good enough mother. It was also seen that in the just a month prior to the attempt, she started leaving her baby with her in-laws for most of the time because she felt that the baby is better without her. So in last month, 2 weeks prior, she finally attempted suicide. Uh, and she herself informed her husband that no, I have done this and I want to get hospitalized, because somehow she realized that she has done it wrong. So there are other also cases in August 2021 during COVID times. Local newspapers in Thailand was having these headlines of a young mother, Pranaya, who committed suicide after killing her 5-month-old son, Arthur, when the husband was bathing inside. She was suffering from postpartum depression, diagnosed, hospitalized twice, on medication, but still one day she took her and her son's life. In October 2010, woman Deepika Parmar, she threw her baby, 1.5-month-old premature baby, from the window of KM Hospital Parel. The baby succumbed due to head injuries. She was the then head of department of psychiatry saw her and she was diagnosed with postpartum depression. She had history of being treated for depression in the past also. So there are cases, certain actresses have also spoken about the postpartum depression they were suffering from. So let's come to the causes. Why do we see postpartum depression? We all know that postpartum period, it's a period wherein there is a tremendous rise in the hormonal level of the blood, and suddenly after childbirth the hormone levels drastically dip down. So this change in the hormonal level impacts a lot on mental as well as physical health of the women. Along with hormonal changes, the environmental and the psychosocial factors are here involved, like lack of social support, lack of emotional support from the family, doing everything alone, and other factors are also responsible. Along with it, genetic factors like family, having a family history of depression, previously diagnosed with a psychiatric disorder. So these all can contribute to postpartum depression. Any traumatic event during pregnancy or difficulty during childbirth increases the chances of postpartum depression. Coming to baby blues, as ma'am told that the prevalence of baby blues is around 70 to 80%. So what are baby blues and how do we differentiate it from postpartum depression? Because for baby blues, usually we do not require treatment. We have to treat postpartum depression though. So baby blues, it's basically, see, having a baby is a big life event. There are a lot of changes in the life. Life never remains the same. So before and after changes a lot. Plus there are other changes, hormonal and everything we talked about. So there are certain changes and a patient may experience a range of emotions that she can experience, like there might be transient worries, there might be fluctuating moods like irritability, there might be crying spells sometimes. She might feel that she's not good enough. How will she able to handle things? Will things go back to the normalcy that was there before the pregnancy? They are also worried about their body, which changes a lot after pregnancy. All these worries, they lead to baby blues. We have to remember that baby blues, it usually starts from second or third day after baby birth, and it usually goes off by itself by 2 weeks, 2 to 3 weeks. It doesn't stay beyond that. So what is the difference? How do you differentiate between baby blues and postpartum depression? So we all have to know postpartum depression is a serious condition and thus we should know about the symptoms. The most important thing to remember here is the symptoms and signs of postpartum depression is always persistent and pervasive. It remains throughout the day, almost all the time. So the sadness will remain. No matter what happens, the mother is not able to feel happy. She is not able to enjoy her motherhood. She feels that there is some inadequacy inside her. She feels that she is less of a woman because she is not able to breastfeed her baby. There can be impaired self-care, social withdrawal. There can be thoughts of taking their own life and harming the baby as well, which is dangerous. And they are unable to function about their normal daily activities. There can be obsessions wherein the mother keeps on checking again and again whether the baby is fine, whether the baby is breathing sometimes. So because of that, there are a lot of sleep disturbances which occur. So, as I told, they feel embarrassed. They feel that they feel guilty because they are not able to enjoy their motherhood, and there might be suicidal ideations because of that. So, what are the risk factors of postpartum depression? Does every woman suffer from it? No. So there can be family history of any psychiatric disorder. There can be previous history of the woman suffering from depression, any trauma during the pregnancy, during childbirth, any kind of complications, lack of social and emotional support from the family, from the husband. All these may contribute to postpartum depression. So, what comes in management? Basically, management involves both psychotherapy and medications. So, medications are very important. Therapy alone won't work in postpartum depression because we have seen cases wherein the patient commits suicide or they kill the baby also. So it's a kind of emergency situation wherein you have to understand that the medications are going to work faster than the therapy. Of course, therapies like individual therapy, cognitive behavioral therapy, group therapy, wherein the patient sits with other women around who are in postpartum period, sharing their experiences, sharing the experience how to deal with the baby, how to deal with the normal responsibilities. That might help the mother as well. So medications, what are the medications safe in postpartum period? We have to remember during pregnancy or during breastfeeding, any medication, any psychotropic medication you prescribe is going to cross the placenta as well as the breast milk. So there are certain guidelines that we have to follow while giving the medications. However, SSRI are considered to be the most safe. So, prognosis. What is the prognosis? What happens if we don't treat postpartum depression? It can lead to chronic depressive disorder in the women. There are high chances of her getting suffered from a chronic depression or some kind of mood disorders later in life. What happens to the child whose mother is suffering from postpartum depression? The child may also suffer from certain behavioral problems, lower academic grades. They may have certain cognitive and language delayed development. So we have to consider. Also, there is increased risk of postpartum depression in the father as well. So, 2 lines about postpartum psychosis. What is postpartum psychosis? It is different from postpartum depression in the form that it is more acute and there are more symptoms of psychosis like delusions and hallucination. Andrea Yates, American, in 2001, in June, she killed her 5 children in her bathtub by drowning each one of them one by one when the husband was at work. In her 4th pregnancy, she was diagnosed with postpartum psychosis, wherein she tried to kill herself twice. She was hospitalized twice. She was advised by her psychiatrist not to conceive again because the chances of postpartum psychosis would increase in the next pregnancy. But still, she got pregnant. She got a baby girl. She was on haloperidol, which was stopped later on. In the 4th month postpartum, she lost her father, after which her condition deteriorated. She had a delusion wherein she believed that her children are corrupted by Satans and if they live, they are going to go to hell and the God won't allow them to heaven. So she killed each one of them at home. She had other hallucinations also, but this is what postpartum psychosis does. It's very acute and it's a psychiatric emergency, an emergency other than suicide. So they have to be admitted, they have to be taken for ECTs or medications. That's all. Thank you so much. I'll hand over the mic to Dr. Rohit for the next topic. Thank you.
Good morning, everyone. My name is Dr. Rohit Singh. I will be talking about vaginismus. Has anybody heard this word before? Vaginismus, क्या होता है? Vaginismus क्या होता है? Yes, spasm. Something which is not very pleasurable as far as sexual experience is concerned, and none of us would want to have this kind of an encounter in our sexual experiences. It's painful intercourse, in short. Painful intercourse. But there is something else as well. There is dyspareunia, something called as dyspareunia. Dyspareunia and vaginismus both are very closely related. The only difference is, see, both of them will cause painful intercourse. But what is the thing with vaginismus? Vaginismus mein there is spasm of the muscle before penetration itself. So it is anticipatory pain. The woman is anticipating pain because of which the muscle go into spasm. The fear response, kabhi bhi when we are, let's say, angry, when we are fearful, when we are anxious, muscle tone ko kya hota hai? Does it increase or decrease? Yeah, so the muscle tone is increasing, yani कि vaginal musculature is hypertonic at the moment. This gives a feeling as if when the husband tries to penetrate, it gives a feeling that he is hitting a wall. This is vaginismus because anticipation hai pain ka, so there is fear leading to spasm of the muscle, not allowing any penetration to happen. This is a very common cause of non-consummation of marriage as well. So when people come to you, especially family physicians would be encountering so much because the trust of patients on family physicians is much greater than I think consultant doctors, and I'm pretty sure people will believe and agree with me here. So when people come to you, there is non-consummation of marriage. We have to look into something called as vaginismus ki koi sexual intercourse related issue hai kya. It's not always erectile dysfunction in men, it's not always premature ejaculation, it's not always impotency. Sometimes a lot of times it is vaginismus also. So we have to look from the other perspective as well. So it's a painful condition wherein the muscles of vagina tighten or contract in anticipation of pain. Dyspareunia is when penetration occurs and there is pain. Vaginismus, there is anticipation. Penetration hua hi nahi tha, fir bhi pain ho raha tha. It may have burning sensation or often cannot undergo any gynecological examination also. So the moment, let's say she is supposed to undergo gynecological assessment, even before the doctor tries to insert his or her finger, she will have a response, a contractile response wherein she brings in both the thighs or sometimes also lifts the buttock from the table. That's very classical of vaginismus. About 15 to 20% of all women experience pain during intercourse at some time. So painful intercourse to hota hai, bahut baar. A lot of time, us also, normal life mein bhi, we have painful intercourse for various reasons. Sometimes there could be infections or any other cause. But vaginismus, the intercourse is impossible to happen. So there is fear of penetration, pain. There is fear of unknown, post-traumatic experiences. What kind of trauma you think would there be for a woman to experience this fear? What kind of trauma are we talking about? Child abuse, very commonly. An unpleasant experience related to the exploration of the sexual part or the genitalia or perigenital area by anybody, a man or a woman, when this particular woman was small, in her young age, she must have gone through some kind of traumatic experience in this form. Sexual assault, an experience of sexual assault. A lot of times, myths and misconceptions spoil the party. Now, what do we mean by myths and misconceptions? Kya hai ye? What sort of myths or misconceptions could be leading to this kind of fear in the minds of फीमेल्स? क्या मिथ्स बन सकते हैं? बहुत बार आते भी होंगे आपके पास में. What kind of myths you think would be leading to this sort of a reaction in the women? Yes, ki intercourse is a painful affair, boss. Once this sets in, it can really find deep-seated, deep-rooted belief that this is a painful affair. ये मैं जब भी जाऊंगी करने के लिए मुझे बहुत पेन होने वाला. Bleeding तो is compulsory only. कुछ तो एक स्ट्रक्चर होता है, वो टेयर होता है, वो टेयर होने से ब्लीडिंग होती है, बहुत पेन होता है. These kind of discussion when they are not married, when they were very young and experiences were shared from other people, और जो खुद भी misconception में थे, they also start sharing the same thing and propagate this only. A lot of धात syndrome सुना है हमने? धात syndrome. धात syndrome. मैं पेशाब करने जाता हूँ तो मुझे मेरा धातु गिरता है. ऐसे कंप्लेन वाले आते हैं. Basically, it is all misconception that they have. धातु गिर गया, मेरी पूरी एनर्जी चली गई, मेरा पुरुषार्थ चला गया, मैं किसी काम का नहीं रहा, मैंने बचपन में बहुत सारा masturbation किया था, उसकी वजह से मैं आज बाप नहीं बन पा रहा. All these kind of things. What are these? Are these facts or misconceptions? Yes, myths and misconceptions cause a lot of problem, not just in sexual health, but mental health also and related to other medical conditions also. और आजकल आपके myths और misconceptions को propagate कौन कर रहे हैं? Doctors will know it best, I'm sure. Oh, what's up, the university? Yeah, Googleitis, idiot syndrome. तो now we know very well, right? Idiot syndrome का full form? Idiot syndrome का full form? Internet derived. अरे, we don't know this? Yeah, internet derived information causing obstruction of treatment. Idiot syndrome. So yes, so ये भी a form of a थोड़ा पुराना form of idiot syndrome है. Consequences is pretty unfortunate. Relationship issues, non-consummation of marriage, interpersonal difficulties, stressful marriage, marital discord जिसको हम कहते हैं. So vaginismus is not so pleasant. Treatment, very simple. I will not go into the details of it because I think we are running short of time. How much time do I have? Like at least 2 minutes? 5 minutes? So basically, let's say there is somebody who has come with, I will not be going through the slides, I might take time then. Let's say we have somebody जिसने कहा है कि sir, a male patient comes to you and he says कि हमारा intercourse नहीं हो पा रहा है because wife मुझे allow ही नहीं करती है penetrate करने के लिए. So what we need to do, the very first thing is just you ask everything to the husband first. You have arousal. First of all, you have desire, you have arousal, okay. You have erection, very fine. Erection के बाद the entry is the problem. उनको lubrication होता है क्या? आप लोग का adequate foreplay होता है क्या? These all practical questions. Imagine your own act and ask the patient. So for an act to happen, arousal is important. Arousal meaning what? What do we mean by arousal? Do you agree arousal can be psychological and physiological? So psychological arousal, do I need to go into the depth of it? Everybody knows. What is arousal? Physiologically क्या expect करते हैं arousal में क्या होता होगा? We have to feel free to discuss this. Yes, lubrication. Males में arousal में क्या होता है? Erection. 6:30 से 12 बजता है. Okay. So erection is the physiological response. Either lubrication. So lubrication probably is not happening enough. For lubrication to happen, see, it's like an investment. The more you invest, investment is your foreplay. So what is the return? Return is fruitful sexual intercourse, no? Because there is more foreplay, that's why there is more lubrication and the passage is smooth, the act becomes very smooth and pleasurable. ये सारी चीजें होनी चाहिए, ये सारी history पूछनी है male से. When you get everything here, call for the wife also. Before you refer it to somebody, you can also try and talk to the patient, no? To the wife of the patient. Call the wife, ask her also कि क्या दिक्कत हो रही है आपको? Attraction feel नहीं होता है क्या husband के प्रति? When you see other males or when you see films and movies, do you get aroused? in general उनको sexual arousal नहीं है, then we need to, of course, need to talk and talk and talk and go to her childhood and probably dig out some history. There could be some issues with related to what we just discussed. Talk to her. It could be just simple, not I don't feel attracted towards my husband. Very much possible. She could still not be over her breakup. She could still not be over her other affair or whatever. Maybe ask her in a very accommodative manner, very non-judgmental manner about probably attraction towards somebody else, or is she having an act with somebody else or whatever. All of this needs to be spoken to. Everything. You might think I might offend the patient. Have a very polite and a very accommodative, encouraging environment that she feels encouraged to talk to you about this. Now that is the skill. Vaginismus treat करने के लिए medicines are hardly required, hardly. But if you talk, make her feel comfortable, get things out in a very non-judgmental manner that she feels encouraged कि इनको बोल सकती हूँ भाई मैं, whether you are a male or a female clinician. The skill entirely will depend on these, how you ask these questions. We all know we need to ask these questions, but how do we ask? कि आपको किसी और के प्रति है, किसी और के साथ आपके संबंध होते हैं क्या? All of these questions, they could come out as or perceived as offensive, but you have to ask. That this is the only skill in treating vaginismus. Once all of these things are out, you know, the guidance that you have to give is graded penetration. Now, what do you mean by graded penetration? कैसे dilate करेंगे? कैसे उनको relax करेंगे? What will we do? Anything that you can, any wild imagination. कैसे करना है इनको ट्रेन देन? ये नहीं अलाउ कर रही है. Anything that you can think of? Yes, slow and gradual, starting with the finger, not directly the penis. Finger, probably the most little finger, सबसे thin. First, let the woman start fingering herself. Make her feel comfortable for the first few days only with the little finger. Maybe then some other finger, single only, one. Let her become comfortable for a few days. Then 2 fingers. Let her become more comfortable by herself. 3 fingers. Why 3 fingers, Abhi? Closest to the thickness of a penis or a shaft of penis. Barabar? Closest to the thickness. Imagine. That's one. Secondly, when she becomes comfortable fingering herself, ask the husband to start doing that now on her. Because apna khud ka finger probably also is a little comfortable for her, but a foreign body. That finger is a foreign body. See how she responds. Let that finger go in. 1 finger, 2 finger, 3 finger. Again, see, it's a slow process, but slow process. That's why this will stand the test of time. And this will be everlasting, long-lasting. Sexual experiences will be good. It will take time initially. All of this also comes into your psychoeducation that this is not an overnight procedure. मैं अभी आपको इंजेक्शन दूँ और आप एकदम सही हो जाओगे और जिंदगी भर आपके अच्छे इंटरकोर्स होंगे. ऐसा होगा नहीं. ये समय लेगी चीज़, क्योंकि ये बहुत सालों से ये चीज़ आई चली है आप में. तो 2 दिन 10 दिन ज़्यादा लग सकता है. You need to be very calm and composed and trust the process. Then work on the chemistry between the husband and the wife, and then probably little bit of sexual intercourse starts with the help of a lubricant, 2% jelly or 5% jelly depending upon lubricant के साथ. Then she is taking control of the entry wherein she is on top. Let her take control just like how she was taking control of the finger first. Then maybe put the husband in controlling position. Then husband starts penetrating, and gradually with local anesthesia in form of that jelly that I'm talking about, gradually things start to happen. One most important thing that remains throughout life is going to be the chemistry between the two and understanding. This is vaginismus. I will run through the slides, myths and misconceptions to be addressed, and the graded manner in which we expose the patient to penetration. Thank you very much. Thanks a lot.
Thank you, Dr. Rohit, for taking us through such a sensitive and sensuous topic like vaginismus, and Dr. Rashmi madam for helping us fight depression in our postpartum patients. I now request our chairpersons, Dr. Shalin Soni sir and Twinkle Jain Sen madam, to please felicitate our speakers. Dr. Rashmi ma'am, can you please come on stage, please?